Hi, my name is Chelsea Stewart. I'm currently a nursing student at West Coast University in Southern California. Today I'm going to be discussing an article from my epidemiology class entitled Preventing the Spread of Measles, published in the Practicing Nursing Journal in June 2013. It was written by Jean Watkins, who is a retired general practitioner from New Hampshire. The article discussed a measles outbreak in Wales in 2013. It was a record-breaking number of cases that year. A total of 1,225 patients were actually positive. The part I found most interesting was the fact that only 10 of those patients had actually received a MMR vaccine prior to the outbreak. That means this outbreak was completely preventable. I thought it was a very interesting article. It described first and foremost what the measles are, prevention, management, complications, progression, and a case study of a child, actually a 3-year-old, who had it. How would these researchers find out how many cases occurred during this outbreak? They did surveys and found out how many of the positive cases occurred during the 2013 outbreak compared to the previous years. They also conducted a survey of how many of the patients had received the MMR vaccine prior to getting the measles. They also did follow a case study to see how the disease progressed in a 3-year-old child. They followed the child and his mother around and discussed with the mother how she recognized the signs and symptoms, how he got treatment, and how the disease progressed. I would call this a quasi-experimental experiment, which is an experiment which involves selecting groups. In this case, it would be the groups of the patients that were positive, upon which a variable is tested without any random pre-selection processes. And in this case, it would be how they would survey how many of the positive patients had actually received the vaccine prior to getting the measles. I think this article was a little limited. Um, I would have enjoyed it a little bit more if they'd had a couple more case studies, maybe like 2 or 3 total, to kind of compare and contrast, the experiences that these parents had with their young children having measles. I think that could have made it a much more effective article. As far as the results, they showed a direct correlation between the cases of measles that developed after parents who chose not to vaccinate their children. This further proves that vaccines are a must and could have prevented this outbreak. We need to further educate parents on the importance of vaccinating our children in order to prevent these outbreaks. This is especially important in today's society, considering the new fad is not to vaccinate your child. Many parents need to understand the importance of these vaccinations and the effect they could have on other people. For some reason, they have believed these studies that vaccines may cause autism or other birth defects, or they claim their children have like an allergy to egg yolks and stuff like that without any actual medical evidence to back it up. So these patients and parents are not vaccinating their children, and thus creating an epidemic for the rest of us. Very informative and very interesting. It described the symptoms so I can easily identify them if I see any of them on my daughter. This is a very strong article. I think this article really proves and hopefully stops all of the anti-vaccination that seems to be going on nowadays. I want my daughter to be safe from the measles, but I wish I could convince other parents to do the same. This article hit pretty close to home. I've been a phlebotomist for about the last 6 years, and during December of 2014, we had a small outbreak here in Southern California. At the time, I was 6 months pregnant and was shocked by the patients that came in to our ER positive. We had a young woman in her 20s who came in, and she had never been vaccinated. She was sent home with instructions and came back about a week later with her 3-month-old daughter. She stated that she continued to breastfeed her young infant and was shocked to find out the baby had actually contracted the virus. I think we really, really need to work on our education system and hopefully prevent many cases like this one. I think the first step to prevention is education.